Okay.
Okay. Assalamualaikum and good evening to fellow friends and lecturer. We are from section 1 of SBG2463 cartography. Our title map is number of COVID-19 positive cases with VOC and VOI variants by state in Malaysia 2022. This is our group member. Myself is Nur Hidayah binti Shahrudin, Siti Nazikah binti Zainal Abidin and Muhammad Syafiq bin Muhammad Zain. Okay. For the introductions, a novel human coronavirus, severe acute respiratory syndrome coronavirus, was identified in Wuhan, China in December 2019. Coronavirus are a type of virus that cause a pandemic of respiratory illness called COVID-19. In Malaysia, the cases of COVID-19 has reached a total cumulative 2,996,331 until 11 February 2022. Most people infected with the virus will experience mild to moderate respiratory illness and recover without requiring special treatment. However, some will become seriously ill and require medical attention. The older people and those with underlying medical conditions like cardiovascular disease, diabetes, chronic respiratory disease, or cancer are more likely to develop serious illness. This is the type of variant of concern VOC, which is the alpha, beta, delta, and omicron. And the variant of interest VOI is eta, kappa, and theta. These are the COVID-19 symptoms consist of three types, which is the serious symptoms is according to shortness of breath, loss of speech or mobility, chest pain. And second most common symptom is fever, cough, lost taste or smell. And the less common symptom is sore throat, HH, rash on skin, itches in pain, and red and irritated eyes. For the COVID-19 preventions that has been advised by Ministry of Health Malaysia, there have been three simple ways to prevent transmitting virus to others. First is when you're coughing, cover your mouth and nose using tissue, and then throw the tissue in the trash after using it and wash your hand properly. Second, use face mask whenever being in public or close contact with people. Third is always maintain good personal hygiene and cleanliness. Second is TRIS. TRIS is advisable since NCO has been lifted and the people have a chance to cross the state boundary. First, we need to do a test, report, isolate, inform, and seek the hospital when you are in serious conditions. Okay. For the problem statement is COVID-19 is an epidemic and significant threat to public health. Global expansion was rapid, with at least one case now recorded by 146 countries. COVID-19 is the largest and most dangerous disease cluster observed in the world in all outbreaks. COVID-19 is becoming a global crisis in which the planet has collapsed and death from this epidemic. In 2022, Malaysia has been recorded with 21 and 315 active cases, but the Malaysian people cannot identify the clusters of variants that have been hit in Malaysia.
Okay. My name is Siti Nur Hasika binti Zainal Abidin. I will present about aim. The aim is to identify the impact of COVID-19 cases of variants VOC and VOI in Malaysia on 2022. Next, the objective is to represent the distributions of the variants of COVID-19 in map to analyze with which variant has the most cases in Malaysia and to identify the type of variants of concern and variants of interest. Next, this is our map uh, poster. Number of COVID-19 positive cases with VOC and VOI variants by state in Malaysia 1992. Next, discussion. The distributions of COVID-19 cases according the variants of concerns VOC and variants of interest VOI in Malaysia 2022. The state map above show the cumulative data of COVID-19 variant in 1992. The color ramp that we use consists of 10 color to differentiate the population, namely the dark blue, which indicate the highest population, and the light blue is the lowest population. The pie chart on the map is showing the percentage of the variance, and the color of pie chart represent the type of variance. Next. Conclusion. In conclusion, from our observations and studies, we found that COVID-19 cases in Malaysia has been increased starting in December 2021. Although our country has been hit with a dominant variant of Alpha, Beta, and Delta, the number of cases is still in control. However, starting the new year of 2022, a new variant of Omicron has been hit in Malaysia. This variant is very uh, easily to spread, and the number of cases in Malaysia has been increasing rapidly. From the risk mapping, we can educate the people to know about the difference of variants of concern, VOC, and variants of interest, VOI. Next. That's all from us. Thank you.